Rash under the breast. Why does it occur? A rash under the breast should not be a cause for concern. However, if it causes a lot of discomfort, is persistent, or is accompanied by other symptoms, it is advised to visit the doctor. The rash under the breast is caused by multiple reasons. In most cases, it has to do with health conditions that are treatable and not dangerous. However, it could also be a symptom of cancer. Many times, the rash under the breast is due to excessive sweating in that area. It can also be caused by wearing the wrong bra. It is common for it to be accompanied by redness and itching. It can appear in the form of peeling or blisters. The rash under the breast. The breast is a modified sweat gland that is covered by skin. It has a complex architecture that is transformed by certain physiological stimuli. The skin of the breast fulfills a function of protection, regulation of temperature, and metabolism. In most cases, the rash under the breast is associated with a skin problem in that region. Typically, a reddish-brown rash appears, which is itchy and prompts scratching. Sometimes there is also suppuration and scabs form. Also, it is possible that these rashes give off a bad smell. Causes of rash under the breast. Most often, the rash under the breast is caused by excessive sweating or rubbing. Over time, this may lead to bacterial or fungal infections. There are also other types of diseases that cause this symptom. Let's see. Miliaria. Miliaria occurs when the sweat glands become blocked. If this occurs, sweat cannot be excreted and accumulates. The effect is inflammation and the appearance of a rash. The usual thing is that it occurs when it is very hot. It usually goes away without treatment. Candidiasis. Candidiasis is an infection caused by the yeast Candida. It is one of the usual causes of the rash under the breast, since this area is warm and humid, which facilitates the proliferation of the microorganism. Blisters and small cracks form that are very itchy. It is almost always treated with antifungal creams. Tub. Ringworm is an infection caused by fungi in the outer layer of the skin. These feed on dead keratin, which is a protein that is present in your nails, hair, and skin. The appearance of the disorder is that of round patches with a red ring. It is treated with over-the-counter antifungal creams. Allergies. The rash under the breast sometimes corresponds to an allergic reaction. It occurs when you come into contact with a substance or allergen. It can be a food, medicine, pollen, plants, or insect bites. The reaction that occurs is hives, which are characterized by intensely itchy red bumps. If such lumps are squeezed, they turn white. Usually, it is treated with antihistamines. Atopic dermatitis. Atopic dermatitis is an autoimmune disorder that is also known as eczema. It leads to patches of red or reddish-grey skin appearing on different parts of the body, including the area under the breast. It may also cause small, fluid-filled lumps to appear. These ooze and form crusts. Keeping the skin moisturized is a good measure to prevent the condition. Tips to get relief. Most often, a rash under the breast is harmless. The discomfort that is caused can be treated with simple measures at home. The main recommendations are as follows. Do not wear a bra until the rash is gone. If used, it should not be too tight or have rods. Use a fragrance-free soap. Apply cold compresses to the affected area. Wear loose clothing, preferably cotton. Mixing 6 drops of tea tree oil with 4 tablespoons of olive oil can be a good home remedy. You just have to dip a cotton ball in the mixture and apply it under the breast, making circular movements. When to consult a professional. When the rash under the breast is very painful or persistent for many days, it is best to see a doctor. Also, if there is a fever, nausea, or vomiting, or sores that do not heal, it is always best to be safe than sorry. Thank you for watching. Don't forget to like, comment, and subscribe.